to this side event, the Value of Vision, the Roadmap to Global Summit. It's co-sponsored by governments of the UK and Malaysia, alongside site servers, and co-organized by IAPB, CBM, and the Fred Hollows Foundation. We are very honored this morning to have Her Royal Highness, the Duchess of Edinburgh, and many ministers of health with us today for this event. What we are going to go through is have some keynote speeches followed by a panel discussion, and we have some very distinguished people here on the panel that we are going to be talking to as we go along. So with this short introduction, because I know we just have a very limited time, I'm going to just introduce Her Royal Highness, the Duchess of Edinburgh, who has been a champion of eye health, and she's a global ambassador of IAPB. And I was just talking to her a few minutes ago that she also started and then championed the Queen Elizabeth Jubilee Diamond Jubilee Trust for trachoma. And that was such a catalyst that, to the last count that I know, and please do correct me, now we have 31 countries that have eliminated trachoma. And that's a huge achievement. And that all started, Your Royal Highness, with that kickstart with the trust. With that, I'll hand over to you.
Thank you, Dr. Qureshi, and Your Excellencies, ladies and gentlemen, and a lot of doctors. It really is delightful to be with you today. And I know that my words today are probably going to be preaching to the converted, or at least I hope so. So forgive me if I'm stating the obvious, but I think opportunities like today do give us the chance to revisit the intention of what today is about as we move towards the Global Summit in November. But I would also like to add my own thanks to the United Kingdom government and also the government of Malaysia for making today possible. So thank you very much. There are really three main points that I would like you to consider as we meet. First, it's about the scale and the importance of what we're dealing with. Second, the strength of the case for investment. And third, the historic opportunity that now lies ahead of us. Currently, and I know that you have on your tables in front of you some information, but there are more than 1 billion people living with sight loss, which could either have been prevented or treated. And this is not through lack of solutions, but through lack of sustained, prioritized action. Imagine, if you will, this 1 billion actually knowing that living in the shadows, unable to work, unable to learn, reliant on others, a strain on your already stretched family, or alone on the streets. Imagine accepting that this was your lot, but it could have been so very different. Through my work in avoidable and treatable blindness around the world, I'm fortunate enough to have been present many times when sight is restored. They have actually been experiences like no other, more like miracles or Lazarus moments, if you will. Because in those precious seconds, not only can someone see once more, their life, which up until then has been severely curtailed and sometimes in danger, opens out in front of them. Possibilities stolen from them, like their sight, come back into view along with their dignity, and now no longer a burden to their families. They have the chance to lead a productive life. The value of vision is not just a moral argument, it's an economic one too. And I know amongst you here today there are representatives who shape health budgets and national development strategies, who need to know and understand the very real benefits of investing in eye health solutions. And the case for investment is compelling. For every dollar invested in eye health in low and middle income countries, a return is multiplied by 28. Investment in eye health leads to higher employment, improved productivity, better educational outcomes, and improved mental well-being and longevity. It also has other significant impactful community health benefits, including the reduction of illnesses caused by poor sanitation and access to clean water, as well as delivery of immunization medications for a range of treatable diseases. Eye health accounts for up to 10% of patient consultations in many low and middle income countries, yet receives less than 1% of national health budgets. This gap is neither sustainable nor is it justifiable. So what lies ahead? On November the 2nd this year, the government of Antigua and Barbuda will host the first ever global summit for eye health, alongside the Commonwealth Heads of Government meeting, in collaboration with the World Health Organization. Heads of state and government will gather alongside eye health leaders and founders to make deliverable, measurable commitments. Between now and November, there is an important opportunity and an imperative to begin the critical conversations that should not start at the summit, but should culminate. For this summit to succeed, we need leaders and governments to decide ahead of November on what they're prepared to commit to and what action and investment is required to deliver real change for their people. So today we're saying, don't wait until November. Start now in shaping what you can announce at the summit. Come full of suggestions and sound strategies to scale surgeries, increase funding, and access to services. If I thought for 1 minute that we couldn't do this, I would not be here. But I've seen for myself how countries have turned the tide on eye health issues and have made life-changing but simple and cost-effective treatments available to their populations, meaning that conditions like blinding trachoma are now being consigned to the history books. It can be done. We have the know-how. We just need your will and your commitment. Sight is a precious gift. So often in this world, solutions for health can be complex and expensive. Our gift to you is a win-win. Invest in sight, and you invest in individuals, families, communities, regions, and your country's futures. I invite you to be ambitious. You have in your hands the power to transform lives and give back people their world. It really is possible. Thank you.
Thank you very much, Your Royal Highness. You're absolutely right. I think the eye health is part of a much bigger development agenda than just vision itself. And building up to the Global Summit for Eye Health, today's event actually is a key milestone towards it. And these are the events that will actually prepare us for the Global Summit. And as you rightly said, we need to start thinking of commitments before we get there, because that's the time when we will make the commitments. And then, of course, the bigger task would be then to ensure that those commitments are implemented as promised. But thank you very much. And then I'm going to go on to His Excellency Dr. Ahmed, who is the Minister of Health for Malaysia. By profession, he's a toxicologist, I'm told. And thank you very much for coming.
Thank you.
Your Highness.
Thank you, Dr. Qureshi. Her Royal Highness, Duchess of Edinburgh, Excellencies, Honorable Ministers, distinguished delegates, esteemed colleagues, ladies and gentlemen, a very good day indeed to all of you. Now, it's truly an honor to be with you today as we bridge the critical gap between policy endorsement here in Geneva and the historic upcoming Global Summit for Eye Health in November this year, to be hosted by the government of Antigua and Barbuda. The data remains a sobering call to action. Over 1.1 billion people worldwide live with avoidable sight loss. This is not merely a clinical challenge, it is a profound issue of equity and sustainable development. While highly cost-effective interventions exist, they remain out of reach for many people across the globe due to uneven access and insufficient integration within national health systems. Our presence today signals a collective shift in priority. By recognizing integrated people-centered eye care as an essential component of the universal health coverage, we acknowledge that vision is essential to a person's ability to learn, work, and thrive. In Malaysia, we are committed to move beyond rhetoric by proper planning and implementation to improve access. We are working to dismantle the barriers, be they geographical, financial, or social, that prevent our citizens from receiving essential care. We specifically target and monitor for effective cataract surgical coverage and effective refractive error coverage. To measure our progress with clinical precision, we also evaluate the performance consistent through the National Eye Survey and National Eye Database and implement corrective measures. Ladies and gentlemen, technical tools alone are not enough. We need strong level political commitments to advance the global eye health agenda. I encourage fellow member states to use this side event as an opportunity to exchange views, share experiences, and explore potential areas of collaborations towards the Global Summit for Eye Health to be held in, as I've said, alluded earlier, in November 2026. Let us continue working together towards meaningful and actionable commitments for better eye health globally. Together, we can transform this shared vision into a reality where no one is left behind in the dark. Thank you. Chair.
Thank you very much, Your Excellency. Then I would like to introduce Mr. Jamie Hamill, who is the Deputy Head of UK Mission to the UN. He joined the diplomatic service in 2013 and has been posted to the UK delegation to NATO in Brussels, a political counselor in Khartoum, Sudan, and external political counselor in Seoul. Mr. Hamill, please.
Thank you, Dr. Qureshi. And thank you to Her Royal Highness the Duchess of Edinburgh for her opening remarks, to the Government of Malaysia as co-host, and to the IAPB, the World Health Organization, and everyone who's taken the time to join us today and support this discussion. I'm delighted the UK Government's been able to co-host this event. Eye health is fundamental to education, employment, productivity, and inclusion. It's therefore both a health and a development priority. Yet the scale of unmet need remains profound. As Dr. Ahmad said, there are more than 2 billion people living with vision impairment globally, and at least 1 billion of those cases are preventable or untreated. As is so often the case, the burden falls most heavily on those already at the greatest risk of exclusion, including women and girls, older people, and those with the least access to services and support. The World Health Assembly has set a clear direction through its focus on integrated and people-centred eye care and measurable targets, including effective cataract surgery and refractive error coverage. So we have the agreement, but the challenge now is implementation. The UK is clear that eye health must be integrated within strong and inclusive health systems and advanced through universal health coverage. Our approach is to embed eye health within our wider health and development priorities. And that's why we'll continue to support the World Health Organization and the wider multilateral health infrastructure and architecture, prioritising resilient health systems, primary health care and country-led financing. Blindness and visual impairment remain an important part of our wider work on disability inclusion. UK-funded programmes such as AT 2030 and At Scale are expanding access to assistive technologies, including vision products, supporting innovation and helping countries to secure practical solutions. These efforts demonstrate that progress on vision impairment can and should be delivered through system strengthening and inclusive development. We've also seen what can be achieved through targeted action, including, as we've heard today, in the effort to tackle diseases such as trachoma, where sustained international collaboration has delivered real impact. Looking ahead, the Global Summit for Eye Health, even, in Antigua and Barbuda in November, will provide an important opportunity to maintain momentum on this and translate commitment into delivery. For the UK, success here will mean ensuring that eye health is firmly embedded in national health plans, backed by sustainable financing and aligned with wider efforts on universal health coverage, ageing and non-communicable diseases. Let me conclude with 3 brief points on integration, equity and partnership. First, on integration, eye health must be part of primary care, community health systems and broader universal health coverage efforts. Second, on equity, our focus must remain on those who are currently left behind, particularly in low and middle income countries. And thirdly, on partnership, this means continued collaboration between governments, the World Health Organization, civil society and organisations such as the IAPB, which will be essential to sustaining progress. That's why events such as this one matter. They help sustain political attention, strengthen partnership and support delivery. So thank you again for your participation here today. I'm looking forward to hearing from the distinguished speakers who will follow. Thank you.
Thank you very much. I think your last 3 were the key things in eye health: the integration, the equity, and the partnership, without which we would never be able to reach the unreached that we all strive for. I would like to acknowledge the presence of Dr. Yassin Hasban, the ex-Minister of Health of Jordan, and he's currently the chairman of the Health Committee at the Senate House. Would you like to say a few words?
First of all, I am totally honored to be here with you. In fact, I'm not an ophthalmologist, but I spent 30 years in the field of medicine, and I used to be the chairman of the King Hussein Medical Center in Jordan, and I was the Minister of Health, and now I am the chairman of the Health Committee in Senate House. This is my 4th time since 2013 until now. We have a very good relation with WHO, and unfortunately our minister, Dr. Abdur, couldn't come for technical reasons, and I shared this meeting with my colleagues, Dr. Salah Halasse. He is in the Health Committee. I would like just, I'm sure what you are discussing here is very, very important subjects, and we need to work together in this field. Thank you very much.
Thank you very much. I do remember going to Jordan and seeing one of your excellent primary healthcare facilities. And I thought that that's something that countries in the Emerald region can actually look and see how it can be replicated, because that was so well done and so very well connected to the healthcare system. That was really great to see.
I think it was the help of our last king, King Hussein. He helped us. And I myself, I attained in United Kingdom. I'm graduated from Eastman Dental Hospital. And I went to State University of New York at Buffalo. So when our king, he was helping the health system, and he mentioned once, if I am not a king, I would be a doctor.
Thank you. Can I then move on to Dr. Farrar, who is the Assistant Director General, Health Promotion, Disease Prevention and Care. Thank you very much.
Thanks.
Please, go ahead.
Very much indeed. And Your Royal Highness, thank you very much. At these events, these weeks, there are many activities going on, and I think, as you can see from attendance here, this had great interest across all countries. In fact, looking around the room, I can see all regions of WHO represented here, and I think please do not underestimate the influence and voice you can have and are using with great humanity, generosity of time and spirit, but also a absolute commitment to pragmatic solutions that actually can be measured and change people's lives. And for that, your reputation goes before you, but it's clear from your speech that you live and breathe that, and we are hugely grateful. So thank you very much. We also, you may have noticed, those who understand or perhaps can hear British accents, that we have a sort of Scottish takeover, I think. And I spent a lot of my postgraduate training after London in Edinburgh, so it's a place I also feel still very much at home in, and it's an amazing training there, including in eye health. So home from home. Thank you also to, obviously, the UK and Malaysia coming together on this with other partners as well, and it's great to see, for instance, the comments from Jordan there. This is an issue which touches all lives in all countries, in all regions. And yes, the weight falls on lower middle income countries, but actually this is an issue which binds us all together. And in a world which is fragmented, for us to find health issues which are universal and bind us together is very important. In a polarized, fragmented world, working together is absolutely critical. And this is an issue, east, west, north, south, it affects everybody. And Your Royal Highness, as you said, it is an eye issue, but it's so much bigger than that, because it's an issue across the whole. I'm a doctor. It's the whole of medicine. You can see through your eye almost. You can see into the brain. You can see into how the heart is functioning, how the kidneys are functioning, and this is not just about eye health. It's an even bigger issue than that. But it's also an issue of equity, and I think this area of medicine and science has probably progressed as fast as any other area, actually. Yes, cataract surgery has been a fundamental area, and trachoma has been. But look what is happening in this sector around gene therapies and restoring sight. This is a scientific powerhouse. And I do have a worry in science at the moment that science could drive greater equity and access globally, or it could drive greater inequity. And I think if we could use the eye agenda as a way of driving greater equity of access to healthcare and giving you a sight not just on your eye, but on also the rest of your body, then we can persuade not the people that you said preaching to the converted, but we can persuade those in other areas that perhaps need some persuasion. So we should come together, I think, as a community and work out how we do that. Your comment there also just shows how practical you are, that when you see somebody that's just had cataract surgery and has had a life restored, it is a life-changing moment for you as well, as you described. And that is absolutely an amazing achievement which affects people's lives for the rest of their lives. And so as we come together, we have had, as you know, a very painful period at WHO over the last year, but I reassure everybody that this agenda within the team, the division that I lead, will remain on the agenda for us for full time. We talked last week, Peter, about how we can work internally in a better way to focus on our core mandate and our normative work and our science and our convening, but also to leverage this incredible community, I think of over 400 institutions networked through the generous spirit of IPD. So let us work together in that spirit, and we very much look forward, and we hope we will get an invitation to the summit in Antigua and Barbuda in November. And as Her Royal Highness said, let's not wait until November until we take action. But equally, I might add to that, let's not stop acting on the 3rd of November. Let's use that as a catalytic moment to change the way we did. And then finally, it's a privilege to be here. It's a privilege to work at WHO. With that privilege comes responsibility. And it's not about warm words. It's about the pragmatic, practical, impact-driven approach that Your Royal Highness gives to us that we should take away when we leave here and commit in the next year to actually making a difference. And if we come back in a year's time, we hope you'll return, then we should hold ourselves to account for what we've personally and individually and institutionally done. So thank you so much for coming. I know how busy, I can imagine how busy your timetable is, but you can see how much it's appreciated. Thank you.
Thank you.
Thank you very much, Dr. Farrar. I'm very pleased to see that WHO still maintains vision as one of its important areas, knowing very well that there are so many global priorities at stake at the moment. And left to Global Summit, I don't think you need an invitation. I think you're part of it. So, but thank you very much. That was very nice. Now I'm going to invite, we've got something open. Okay, so I'll invite Dr. Stuart Keel, who is the WHO technical lead within vision and eye care in the Department of Non-Communicable Diseases and Mental Health. He's done a lot of work. If I was to sit down and list all the things that he has spearheaded, I think there would be quite a bit. But the work he's done on the ECSC and the EREC, which we'll hear today, I think has been tremendous. So,
thank you
Stuart.
very much, Baba. Much appreciated. So for the next few minutes, we want to just go over a technical briefing, starting with three key topics. The first is looking at these global eye care targets that we've heard about in the last minutes and seeing how we're progressing towards those global eye care targets. Then looking at WHO's focus in the area of eye care and how we're supporting member states, but also stakeholders in moving this agenda forward. And then we're also very happy to launch a new document today, which we'll briefly introduce at the end. But let's start with the global eye care targets. We have heard about these previously. So in 2021 at the World Health Assembly, these two global eye care targets were endorsed, linked to the two leading causes of vision impairment and blindness and the two biggest public health problems when we think about eye care. Also linked to two very cost-effective interventions that we've heard about. Specifically, these targets are a 40 percentage point increase in effective refractive error coverage and a 30 percentage point increase in effective cataract surgery coverage. Recently, together with our academic collaborators, our collaborating centres, we've come together and put together new estimates at the midpoint of these global targets, and I just wanted to introduce some of the key findings from these new reports. And the first is at the global level. Effective refractive error coverage and effective cataract surgery coverage are estimated to be 65.8% and 48.2% respectively. So what this means is there's still a third of the population, global population, who need a pair of eyeglasses, and there's still over half of the world's population who don't currently have access to cataract surgery. So these people are living with vision impairment and blindness. What this results in is quite a substantial backlog and unmet need for these two very cost-effective interventions. It's currently estimated that about 800 million people globally don't have a pair of eyeglasses, and close to 100 million people need access to cataract surgery. Substantial inequities are also observed in this data. there was a clear trend found between lower access and lower World Bank country income levels, specifically eyeglasses and cataract surgery access is over 3 times lower in low-income countries when compared to high-income countries. Significant regional variations also exist in the unmet need for these interventions. If we have a look at effective refractive error coverage, the unmet need ranges from as low as 17% in the European region to as high as 70% in the African region. And similarly, very high unmet needs for cataract surgery were found in the African region, with 3 out of every 4 people in need of cataract surgery not currently having access. If we look at Southeast Asia, where the sheer magnitude of numbers of people needing these interventions is greatest, we see about half of the population only having access. But it's not all doom and gloom amongst these sobering statistics. The sector has done very well. Progress has been made, particularly in the face of a growing population in need due to our ageing populations, due to lifestyle trends that are increasing the number of people with cataract and refractive error. We've seen cataract surgery and eyeglasses access expand by about 15% and 10% respectively over the last 2 decades. But there's a big but here, and the big but is, at the current pace, universal access to these 2 very cost-effective interventions is not going to be achieved until the end of this century. So I think it's important to just think for a moment about the people, about the children in the next 70 years who aren't able to get the education they deserve because they don't have access to a pair of eyeglasses, but also the number of people in the older population who are actually going to die with a vision impairment or blindness before getting access to cataract surgery. So it's very clear that concerted action is needed in this space. Now to introduce WHO's work in this area very briefly. And the first, it generally fits in 3 broad areas. The first is the development of a comprehensive technical package to support member states and stakeholders with implementing what we call integrated people-centred eye care. So we've collaborated with close to 300 experts across all regions to develop this technical package that has a phased approach through planning, monitoring, human resource development and quality service delivery. Of course, as much as I would like to, we can't unpack all of this today, so just visit our website for more information. The second key area is the SPECS 2030 initiative, launched in May 2024. This SPECS initiative has the mission to directly support countries to achieve these global eye care targets that we are talking about by sustainably increasing access to quality eye care services, with a particular focus on increasing access to eyeglasses. So we are pleased to see the demand of this initiative so far in the first 2 years has been very strong. Already 29 countries have committed to national or subnational initiatives. We're working across the 3 levels of the organisation together with international and also local partners to help drive these global recommendations into real country planning, policy change and also action. The last is monitoring and surveillance, where we place a fair emphasis, building off what Baba mentioned earlier. Of course, all of our decisions around eye health planning need to be strongly based on data. So we have been working closely with a huge number of member states in conducting standardised situation assessments to support evidence-based planning and strategy development. We're currently working with a number of member states also, and it will continue to be a priority to support them to integrate eye health within routine health information systems, but also strengthen population-based data on eye care. And one of the more promising areas that we are integrating at the moment is with the routine tropical and trachoma data surveillance. At a global level, we're pleased to be working on the very first global status report for eye care and vision impairment that will be published in 2027. Currently working across most member states now to collect data on policies, legislation, regulation, service delivery, workforce that will come together into individual country profiles into this report. And we'll continue to work with our academic collaborators to produce periodic estimates to measure the impact of what our efforts are doing on achieving the ultimate goal of increasing access and quality. So with that, for 1 minute, I just want to introduce this brief document that we think is an important document, and we think it's an important document because for too long, for decades actually, vision rehabilitation is something that has been neglected. Most of the investment has gone into prevention and also treatment, for good reason, of course. However, if we are serious about equity and we are serious about providing eye care services along the full continuum of care, we can't ignore vision rehabilitation. So that's why WHO is pleased to launch this planning guide for integrated vision rehabilitation today. Provides a structured framework, very practical step-by-step framework to integrate vision rehabilitation within national health systems, but also operational guidance on service delivery across the different levels of care as well. And please go ahead and download this. There'll be some upcoming webinars at WHO to disseminate this further. With that, thank you very much. Back over to you, Baba.
Thank you very much, Stuart. I still want to go to a meeting where you're not launching a new tool. Yeah, but I think one of the key things that has happened is the whole focus on quality, because we've been doing lots of stuff with cataract. One is the recognition of uncorrected refractive error. And then the second is not only doing cataract surgeries, but actually doing them with very high quality. And I think the benchmark that WHO has now set will certainly improve the cataract surgery that we see all around the world as we go along. So thank you very much for that, Stuart. I'm now going to turn to the panelists. Let me just introduce them very quickly. So we have Mr. Bob Williams, who is the Secretary Health from the Cook Islands. Welcome. Then we've got Kathleen Sherwin, the CEO of Orbis from New York. Welcome. We've got Mr. Pascal. I've already apologized for not able to pronounce his last name. And
Bielefeld.
I will still not attempt it. Who is the CEO of AT Scale. And we have Ms. Abigail Steinberg, the Executive Director of the Eyeglasses Initiative at the Livelihood Impact Fund. Welcome. If I was to start, I think the Pacific Islands have done a very interesting thing, that they are preparing a joint statement for commitments for the Global Summit. And what we just wanted to know was what motivated this regional approach and what has made eye care as a priority for the whole Pacific region. Bob.
Thank you, Dr. Baba. If I have to be honest, I thank Fabrizio and Dr. Audrey of the New Zealand Fred Hollows Foundation, because they were bold enough last year at WHA in Fiji to directly approach the Cook Islands and to convince my Minister of Health, who is a female minister, and I express sincerest apologies that she's not here to personally meet you, Your Royal Highness, in joining the rank in being the ambassador for eye health in the Pacific, and also to continue the good work that the great work that you're doing in advocating for eye health across the world, but for my ministers across the Pacific. As we all know that the Pacific is one of the regions with the highest rate of non-communicable diseases. And talking about diabetes, it is a defining challenge for all the countries in the Pacific, and diabetic retinopathy is visible amongst our communities across the Pacific Island nations. And when we talk about our workforce, which is very small, and specialists available to treat eye health across the Pacific is very challenging. It's not an excuse, hence our motivation through the appointment of my Minister of Health as the Pacific Eye Health Ambassador, it is a proposal that we commit to advocating for prioritization of eye health across the Pacific to all health ministers and to all Pacific Island countries. It is very important for now that we prioritize eye health, which has not been taken seriously for many years now. With the appointment of my minister, it is our aim and objective to encourage Pacific Islands to prioritize eye health as the national priority and on their agendas. Thank you.
Then, if I would ask Kathleen, Orbis has supported cataract programs across many countries through workforce development, system strengthening, and outreach systems. Now, based on these experiences, what practical actions or commitments should governments prioritize now? And should we be looking at going one step beyond just control and looking at cataract elimination?
Thanks for the question. As a new CEO, I've been doing a lot of country visits and traveling, and I think to the first question, my experience has been that what gets me very excited about eye health is it doesn't always mean to have transformation doesn't mean a significant financial investment per se, right? It does, though, mean good data, quality, and local leadership. So, for example, I was recently in the Garage district outside of Addis, a few hours out of Addis, and looking at it's called the Boost program. It's essentially very low-cost software that helps improve quality outcomes in terms of patient care. And for $2,000 they were able to significantly improve cataract outcomes because they were able to target exactly where those quality gaps exist. So the point is that, and then this is, I think, to Her Royal Highness said earlier, governments can act now, right? It does not require explicitly large financial investment. So practically, though, to your question around how might we prioritize commitments, I think there would be 4 areas. One is looking at workforce capacity, so making sure that we're training ophthalmologists and nurses and frontline health workers. I think 2, it's institutionalizing quality improvement. We have to be looking at outcomes, not just surgeries. What is the quality of those outcomes? We need to remove barriers to access. I'll put on my gender hat, and that includes putting a gender lens on our commitments. And then, of course, integrating those commitments into UHC, into national health systems planning. I think to your last question, in terms of elimination, absolutely, elimination needs to be in view. I think that we've seen, and this was stated at the beginning, we've seen what's happened to trachoma. We have the ability, we know what the solutions are, and what we now need is political will and commitment. And so, of course, cataract will always remain with an aging population, but I think to use as our North Star the elimination of avoidable cataract blindness absolutely should be front and center as we go into 2030.
Thank you. Thank you very much, Kathleen. I think this whole discussion on cataract elimination is going to be extremely exciting over the next couple of years, because I would not say anything has been easy, but this is really going to be a pretty big challenge in defining it and then measuring it over time. And you rightly say, Kathleen, data is going to be the key to get this all done at the right time. If I was to move on to Mr. Pascal, the 80 scale is launching new initiatives across several countries to support governments in strengthening access and systems for eye care and assistive technology. What kinds of partnerships, policy actions, and summit commitments are most needed to accelerate implementation at scale?
Thank you. Thank you very much, and good afternoon, ladies and gentlemen, and Your Highness. Indeed, at AT scale, the Global Partnership for Assistive Technology, we're have been engaging with a number of countries over the last few years and are poised to increase and expand our level of engagement in the coming period. But our investments are catalytic, and they serve to spur on and encourage and incentivize certain actions, in particular, working closely with governments. And so what really we want to see, besides the actual programmatic work that we're supporting and the results and the reach that we hope to get, is really that commitment from governments to truly integrate not just eye care and eyeglasses in our case, but across assistive technology, and create those services as part of universal health coverage, and to budget all of this in the primary health care package. We would also really call on governments to help embrace innovations that really can make a difference in access. To give you one example, one of the barriers to accessing eyeglasses in many low and middle income countries is the lack of services in rural areas due to a reliance on specialized workforce, bulky and complex equipment, and verticalization of the services oftentimes. There is an innovation, it's not a silver bullet, but it can make a big difference. Handheld autorefractors, right, which allows you to objectively measure someone's refractive error. And we did a study in Ethiopia, Nigeria, and Nepal over the last 2 years to try to really get a better sense of how accurate those new tools were relative to the otherwise gold standard. And really, we found that for many of these autorefractors, it is highly accurate, especially for adult populations. Yet there is still resistance in adopting this. But it can make a huge difference from task shifting and lower reliance on specialized workers and an easier integration into primary healthcare services, as well as outside the clinical setting, right? But we need governments to really pick this up and adopt these innovations much more quickly and back them up with their domestic resources. And maybe the last thing is around public-private and donor alignment, right? And that is also key, especially in today's world. We really need to be able to come together with the governments in the lead, but working closely with the private sector as well, who need to join forces in their own interest, by the way, not as a let's do good only, but really in their own selfish interest by helping create the demand that is out there and that needs to be met.
Thank you very much. Yeah, it's. I'm very glad that you say that this would become a part of the PEC package, because the whole assistive technology is still taking its time in getting to know there. So very good to see this initiative by AT Scale. Abigail, if I was to ask you on the uncorrected presbyopia, which continues to affect millions of people of working age, and therefore having an impact on productivity and livelihoods. Why do you think this issue has remained under-prioritized despite the scale of the problem and the simplicity of the solution?
Thank you so much for the great question, Dr. Babar and Her Royal Highness, and standing on existing protocol. Importantly, the world focused on blindness for many decades and almost a century. And only in the last, I'd say, 5 to 7 years, to many of the incredible people in this room, has it been on a global agenda at the WHO and UN and starting to be recognized. You know, on the documents in front of you, 2.2 billion people, a quarter of the planet, have an eye health condition. Over 1 billion need access to glasses, and about 800 million of them need access to near vision spectacles or reading glasses, which you can get over the counter in Geneva easily at the pharmacy. And it's a big club. 1.8 billion people have presbyopia, or the near vision impairment. So yeah, it was limited focus, limited data, market failures, not enough providers, and the providers are really in rural, they're not in rural areas, they're in urban and peri-urban areas, fragmented, underfunded responses. I mean, there's a litany of reasons why the world said there's many issues we have to focus on, and this was not a priority for a very long time. But you're correct. They cost under $1 to manufacture. We are mobilizing them at $2.50 to $3. And I'm sitting right next to the head of eye healthcare for all of Nigeria, who thinks daily about 220 million people. And together, under her leadership, we were able to launch an initiative with the president and reach 1.5 million Nigerians last year, integrating presbyopia screening and screening for eye health conditions into primary care facilities and community health workers. So yes, there's very cost-effective, scalable interventions. And under her leadership, we also launched, with support of the IAPB and the WHO, the Global Vision Impact Award, because we know governments need the right technical assistance, capacity building, and funding to ensure they can take these commitments and implement them into real policy change. But policy change alone won't change it. It comes with funding for implementation and scale, because we do have cost-effective solutions. The other thing that's exciting about this work is over 90% of the individuals that are referred for glaucoma, limited but trachoma, distance vision, cataracts, other eye health conditions, they're showing up at subsequent care facilities for access for the first time in their lives. And so we don't see this as a one-off. We see this as a pathway to expanding eye health care significantly and healthcare. Last thing I'll share is in Ethiopia, where there's 40,000 community health workers, we've trained 20,000 in the last year with support of Last Mile Health. And what's remarkable is people are showing up at the health facilities for readers, and then willing to get screened for NCDs, and then willing to access other health services. So it's become a gateway for all healthcare and not just eye healthcare. Thank you.
Thank you very much. And I'm very pleased that you talked about screening for eye health along with presbyopia. Because I think one of the things that has always, where people have hesitated a bit, is that not that the giving away readers becomes the principal thing to do, but that actually is an entry point into eye health screening.
Absolutely.
And that's a great way to go in. Now, I have a question for all of you, the same question. So I'll start with you, Abigail, if you don't mind, and I'll go this way now.
Sure.
And that is, as we look ahead at the global summit for eye health, what would meaningful, credible government commitments look like? And more importantly, how do you think these commitments would translate into real implementation and accountability after the summit?
Well, a big part of what we hope to support is, we know eye health departments and Ministry of Health are strapped. They need capacity building. They need technical advisors that can draft policy and support that change and implementation. And then we also know that they need funding and support to kick off these initiatives. So we are allocating funding and working alongside other funders to allocate significant funding to reach tens of millions of individuals to both support on policy change and implementation. And so our work is quite hard leading up to November 2nd, but really, November 3rd onwards, we're quite impatient at Livelihood Impact Fund, and we think this could be solved in well under a decade, and we'd like to accomplish a lot in the first 12 months.
Pascal.
Thank you. So I think in these sort of summits where commitments are being asked, I find that oftentimes, be they governments or partners or whomever, they tend to try to kind of, find a way to make a commitment that's a little bit loose, but sounds really good, but where it'll be hard to be held accountable to, frankly. And so I think we need to really have a high bar in terms of what commitments are accepted as part of this summit. And really, at the end of the day, money talks. And what we would want to see is more money on the table from all sides. And so I think, for me, that's really where the rubber hits the road. And then, of course, with some clear timelines, not too long in the distance, right, to see that come through. And the last thing I would say is, so many of the challenges that countries are facing are the same. And so we all know that collective action is much more powerful than everybody trying to do everyone on their own and trying to find their own solutions. And so commitments that can support collective actions, I think is also something that would be great to try to kind of direct the stakeholders at the summit towards.
Thank you. Kathleen?
Share the same comments. I mean, I think in terms of when we're thinking about the bar for commitments, they have to be measurable. It's not about aspiration, right? So I agree. I would pick 5 if I was a government writing their commitments. The first is financing. Correct. It absolutely has to include dedicated national investment plans for each of the commitments. I think the second is it needs to include coverage. So it does have to include the ECSC and the EREC targets. It should include the workforce. We have to think about how do we continue to plan and expand eye health, human resources to deliver on the commitment, to deliver on the increased capacity. And it needs to include accountability, both in terms of reporting on quality and equity. And it needs to include, of course, a gender lens. And I think we have all of the component parts to make these types of commitments. You've heard we have the ROI, we have the investment case, we have the economic case, we have the solutions, we have the data, and it is life-saving and life-changing. So really looking forward to Geneva today not being obviously a destination, but truly a launching point towards the November summit.
Thank you. Thank you very much. Bob?
In the Cook Islands, we believe political commitment must always be translated into action. Since the appointment of my minister as the Pacific Ambassador for Eye Health for the 2026 Global Summit for Eye Health, it is a clear signal that eye health is not peripheral but central to our health agenda. Currently, we are undertaking a small island state survey to generate robust data, national data. It is evidence-based to guide planning, budgeting, and service delivery. Most importantly, eye health is being aligned with the broader national priorities, including NCD control, child health, aging populations, and equitable access to care. So my minister and my ministry is not only talking but walking the talk, and we'll continue to advocate for regional commitments and prioritization of eye health across the Pacific. So on Sunday, just last Sunday, at the Pacific Ministers of Health meeting, my minister tabled a paper to introduce her appointment to her ministerial colleagues from the Pacific. And following this General Assembly, there will be a scheduled virtual meeting with all Pacific health ministers and heads of health across the Pacific to brief more regarding the summit, and also the development of a unified statement for the Pacific for my minister to present at the Global Summit. On August this year, the Cook Islands will be hosting the Pacific Heads of Health meeting in the Cook Islands, and prioritization of eye health is an agenda item for the Pacific Heads of Health to discuss more and for recommendations to go to the Ministers of Health meeting next year, 2027. Thank you.
Thank you very much. We have amongst us Dr. De Castro, the Chief Medical Officer, Ministry of Health, Wellness and Environment from Antigua and Barbuda, the host country of the Global Summit. Can I request her to please make some comments? Dr. De Castro.
Thank you, Chair. Her Royal Highness, the Duchess of Edinburgh, Excellencies, Honorable Ministers of Health, esteemed delegates and guests, I am honored to be invited to this afternoon's event to share remarks where we have discussed the Global Summit for Eye Health and other initiatives which will be hosted in partnership with the Government of Antigua and Barbuda during the Commonwealth Heads of Government meeting in November 2026 in the beautiful and most often sunny island of Antigua. On behalf of the Government of Antigua and Barbuda, and by extension, the Ministry of Health, Wellness, Environment, and Civil Service Affairs, I would like to express sincere thanks and appreciation to each key partner and stakeholder in this room and beyond for the intersectoral collaboration which you have committed to that is needed to combat such a prevalent issue in society, poor vision and blindness. Antigua and Barbuda welcomes high-level discussions that leverage global leadership on the prevention of blindness and promotion of eye health by bringing together all partners at the table to mobilize resources and transform vision into action. The Government of Antigua and Barbuda is committed to making high-quality eye care available to every member of our community. We acknowledge that most eye diseases are preventable and/or treatable. So blindness prevention programs should focus on accessibility to eye examinations, cataract surgeries, control of infectious diseases, and distribution of corrective eyeglasses. Community-based healthcare services and outreach programs encompass health education, eye screening, early referral, and adequate follow-up, which are among the pillars of preserving vision and preventing irreversible vision loss. Antigua and Barbuda is actively planning, along with the IAPB and WHO, to host a side event that will be impactful and memorable for all participants and produce tangible, positive outcomes for those who will benefit from it. Investment in eye health is a long-term investment in overall health. Earlier, I mentioned the word see because in Antigua and Barbuda, we desire that all people can see and experience the beauty of our twin island nation. How fitting it is to host a side event of such a theme, making the world see the value of vision. Thank you.
Well, thank you very much. And if you could also kindly convey our thanks to His Excellency the Prime Minister for very kindly hosting us, despite being very busy with the CHOGM event, to accommodate another side event. So thank you very much for that. I'm going to move on to Peter Holland, who is the Chief Executive Officer of IAPB. So Peter.
Baba, thank you very much. And firstly, let me express my thanks firstly to Your Royal Highness for your support today, which has been fantastic. But I've had the privilege of working with you for really the past 8 years, and I've seen the commitment you have to eye health globally. It's been truly inspirational. So thank you so much for being here. To the governments of Malaysia and the UK, thank you for co-hosting us today and for supporting us, and particularly to the World Health Organization. IPB has really been a partnership with WHO for the past 50 years. Its history is really incredibly closely aligned with WHO over that period, and I think it's a real example of one of the key themes we've been talking about partnership. And I think that partnership with WHO has been incredibly important in terms of the progress that we've made on eye care, and it's been a real pleasure for me to work Stuart, with you and with the whole team at WHO. Baba, you began today with the theme of trachoma and of the elimination of trachoma, and drew out how important that sustained focus was and what it can achieve. That over the past 10, 15 years, that sustained attention, the partnership working, the commitment has really transformed the work around trachoma. And essentially, that's what we're asking now in terms of avoidable sight loss. Essentially, our goal is to eliminate avoidable sight loss. And I think the themes and lessons that have come out of the work of trachoma are very much the themes and lessons for us, critically working together in partnership and having sustained commitment, sustained political commitment across the world. Your Royal Highness, you set out why that's so important. There's obviously the economic case, but actually it's a really critical moral case. Dr. Farah said eye health is a universal issue. It is a universal issue. If I look around the room, looking at the number of people wearing glasses today, I mean, many of us here know this directly ourselves, and if you don't know it directly yourselves, you will know someone directly who has an eye care issue. And yet there's still 1 billion people who don't have access to the eye care that they need, and that has all the impacts that we've heard today. And we've also heard, particularly from our panelists, that we have the solutions to this. So the challenge really for us now is to turn the commitments that have been made, the resolutions that have been made in the United Nations and here at the World Health Assembly into action, into delivery on the ground. And that's very much the purpose of the Global Summit for Eye Health. And I want to particularly thank the government of Antigua and Barbuda for hosting that summit, but also for your leadership. The government of Antigua and Barbuda, it's not just will be a fantastic place to hold a summit, but Antigua and Barbuda have been one of the strongest supporters of eye health globally on the world stage for the past decade. So I think it's really fitting that the first ever Global Summit will be held there alongside the Commonwealth Heads of Government meeting. And critically, the goal of the summit is to galvanise action and to turn those words into action. But again, I think in the words of Dr. Farah, for it to be a catalytic moment, it's not just enough to hold a summit, it's the work that happens beforehand in terms of the commitments people bring, but then it's the work that will follow. So crucially, it's absolutely right, those commitments need to be measurable so we can really assess progress. And if we can do that, and I guess my ask to every member state here in this room is to join us at that summit, to bring a really tangible commitment that really can drive progress. And in doing so, we can really make progress towards eliminating avoidable sight loss. Thank you.
Thank you very much. And I think talking of trachoma, I would like to acknowledge the huge contribution of WHO, and we have Anthony Solomon here this afternoon, who has spearheaded the whole elimination program at the WHO. Thank you very much, Sol, for all the work. With that, although I was told I can go up to 2:15, but I don't think I need to go up to 2:15. I would just like to say thank everyone for coming to this side event. Thank all the speakers. Your Royal Highness, thank you very much for coming. Your Excellencies, thank you very much for being here, and all the speakers that have been here. I think it's been a great event, and we all look forward to the first ever Global Eye Health Summit. And I think that is very exciting to have, because almost every other specialty has had one, but we've never had one. And the fact that people begin to focus on this and get to a point, because it's not easy to recognize this as a priority and having it. And being an ophthalmologist, there could have been nothing better than having a globalized summit, which we all look forward to. I look forward to seeing most of you, I'm sure, before, but latest at the summit. With that, thank you very much, and have a good afternoon. Thank you. Can I just request the speakers to please, where would you like the group photograph, children? Is it just here? Just if you could just come at the back here for a group photograph. Thank you very much. There is lunch at the, if you go on the right, there is lunch. Please go towards the lunch. Thank you.